name's Taylor, and this is the Basic Proficiency Assessment. I've already completed hand hygiene and provided privacy for my patient. Hi, my name's Taylor. I'm going to be the nurse practitioner student assessing you today. Can you tell me your name and date of birth?
My name is Angelica Smith, and my birthday is January 1st, 1990.
Okay, great. And can you tell me what you're here for today?
A physical.
Okay. And then do you know where you are and the date it is?
Yes, I'm at the hospital, and today is August 27th, 2018.
Perfect. Okay, the patient is alert and oriented ×4 to the person, place, time, and situation. She is calm and cooperative, and she's dressed appropriately for the weather. The next thing I'm going to do is start from her face and doing a full body assessment. Okay, so first thing, can you open your mouth, puff out your cheeks, and then close your eyes really tight and open up. Good. So cranial nerve 7 is intact, and then can you open your mouth, and then, perfect, and then close it really tight. Good. So her cranial nerve 5 is intact. And then also looking at her skin, I can tell that it's warm to the touch, it's pink, there's nothing out of the ordinary, there's no lesions that are causing me to further assess her. The next thing I'm going to do is to look at your trachea. Looking at it, it's midline with no deviation. And then I'm going to put some pressure on your shoulders, and I just want you to try to shrug them against resistance. Good, good. So her shoulders are shrugging against resistance, and then if you can turn your head kind of against mine. Good. Good. And then she has good resistance in her neck as well. Okay. The next thing that I'm going to assess is her eyes. This is my pen light. Okay, so I'm going to do the 6 cardinal features first. So if you just want to look, thank you. If you just want to look straight at me, and then you can follow this with your eyes in all the directions. So go here, 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 here. Good. Okay, so she followed me in the 6 cardinal features. There was no astigmatism or shaking of the eyes. And then I'm going to look at her pupils in the 6 different directions as well. So look straight at me. You don't have to follow the pen light. Good. 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 I'll go here. Good. Okay, so her pupils are equal and reactive to light, and they're approximately 4 millimeters bilaterally. Okay. The next thing I am going to do is assess your lungs and your chest. Watching you breathe upon observation, your chest expansion is symmetrical. You don't have any labored breathing, so not worried about that. I'm going to gently just palpate your lungs. If any place is tender, just let me know. Then I'll go under here. Nothing's tender. No masses are felt anteriorly. Okay? And then I will go ahead and auscultate in the bilateral upper lobes and the bilateral lower lobes. So you can just breathe normally. Good. 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 So she has a normal rate of approximately 16. Her rhythm is normal. There's no adventitious lung sounds, all anteriorly. And then I'll move to her back, and you can just stay right there if you want to. And I'll assess posteriorly. So just palpate gently. Let me know if there's any tenderness. No. Same over here. No tenderness. Good. And no masses were felt either. So I'm going to auscultate and posteriorly her upper lobes and her lower lobes bilaterally. Good. So she is a normal rate and a normal rhythm, and no adventitious breath sounds were heard posteriorly, upper lobes and lower lobes bilaterally. The next thing that I'm going to assess is her heart, and the first thing that I'll assess for is her point of maximal impulse. That's at the midclavicular line at the fifth intercostal space. And I will auscultate. Sorry. Okay, the point of maximal impulse was heard. No thrills or rubbing, anything that would cause me concern. And then I will go ahead and listen to her heart normally, how I would. Start here. Here. Good. So S1 and S2 was heard, no heart murmurs, no thrills. And then I would listen for a full minute to get a rate, but her rate was normal and her rhythm was normal upon assessment as well. The next thing I'm going to do is assess her peripheries. So just going to know her arms bilaterally. There's no edema noted. I don't see any clubbing of her fingernails. And then I'll test her skin tuger as well. Her skin tuger is elastic and doesn't show any signs of dehydration. And then I'll also do her capillary refill on her upper extremities bilaterally. Good. Good. So her capillary refill was brisk. It was less than 2 seconds. And looks good on her upper extremities. I would do the same thing for her lower extremities. You're fine. Just looking upon assessment, I don't see any edema noted bilaterally on her lower extremities. Same with the skin tuger. I would pinch the top of her foot right here to assess the skin tuger. I would also apply pressure to both of her great toes bilaterally to see capillary refill, and everything looks good. She does not have any sluggish capillary refill, and she has good blood flow to her bilateral lower extremities. And then the next thing I'm going to do is feel all of her pulses. So I'll start with your carotid. Good. And then I will move down to her brachial pulses. And I would feel both of them bilaterally. And normally I would I would feel these for 30 seconds or 1 full minute just to make sure that she has a good rate. And then I move on to her radial pulses. Good. Good. They're all approximately 2+, not bounding, not thready, not to the point where I can't feel them at all. They're all good on her upper extremities bilaterally. And then I would feel her femoral pulses bilaterally. So we would just feel. Her femoral pulses are 2+ and good as well. And then I would feel her popliteal. Thank you. Good. And I can just feel this one too. Make sure all her pulses are intact. Good. And then I'll just have you slip off this shoe. Thank you. And then I would feel her dorsalis pedis right here. Good. And then I would do the same thing on her other foot. And then I would also assess her posterior tibialis, which is behind her leg, kind of by her ankle, bilaterally. Feel it right here. And good. So everything's intact. Everything's 2+ bilaterally to her upper and lower extremities. And everything's a normal rate, approximately I would say 72 for a normal rate. And then the next thing I'm going to do is have her lay down and I'm going to assess her abdomen. Perfect. So the first thing I would do is lift up her shirt, look at the contour and the symmetry of it. Her abdomen's symmetrical, it's non-distended, it's soft, and it is an even contour. So I'm just looking at that. And then before I palpate, I will auscultate her bowel sounds in all 4 quadrants. And I would listen for a minute each in each quadrant. But for the sake of time, I'm just going to listen to each. Good, so she has active bowel sounds in all 4 quadrants. Her right upper quadrant, her left upper quadrant, her left lower quadrant, and her right lower quadrant. And then the final thing for the abdomen is I will palpate lightly and then I'll palpate a little deeper for tenderness and any masses. So this is the light. Let me know if anything's tender. Good. And then I would do a little deeper palpation. Sorry. And no masses are noted, and the patient states that nothing is tender on her abdomen as well. So you can go ahead and set back up. And then the next thing I'm going to do is lightly palpate all of her joints in her body. She'll let me know if anything's tender. And then I'm palpating for swelling, heat, and crepitus in any of the joints. Okay, so just do your shoulder here. Everything feels good. Bilaterally. And I'll do your elbow. No swelling, heat, or crepitus noted on any of her joints for her shoulders bilaterally, her elbows bilaterally. And then we'll also do her hands and wrist. No swelling, heat, or crepitus noted. Nothing's tender. Okay, and then I will have you stand up just so I can palpate your hips. Okay, everything feels good here. No swelling. Obviously my patient would be in a gown and I would be looking as well. Good, and then I will feel your spine. No swelling, heat, anything noted in her spine. Good. And then you can set back down and I'll check your lower extremity joints. So her knees, everything looks good. No tenderness, good. No swelling here, crepitus noted on her knee joints bilaterally. And then I'll feel your ankles down here. No heat, crepitus, or swelling noted there. And same over here. Everything feels good. So all of her joints look good. There's no heat, swelling, crepitus, anything noted, and the patient states that nothing's tender. Then I will go ahead and check her range of motion and her strength. So I'll have you stand up one more time. Sorry. And I'll have you put out your hands. And I'm going to put resistance on right here. So you just try to go against it. Good. And then I'll do the same thing down here. Good. And then I'll have you put your hands like this. And I'm going to push against and you just add resistance. Good. And then I'll have you do the same thing and push up against. Good. And then you can squeeze both my hands also. Good. So in her upper extremities bilaterally, strength is equal, and she has full range of motion in all of her joints. And then if you want to just like you can turn your head this way a little bit. Like look at me. Yeah. Good. And then same thing over here. Good. So her neck is good. And then if you want to just bend here and bend here for your hips. Good. Awesome. And then you can set back down, and I'll go ahead and assess your strength in your lower legs. Okay, so I'm going to push here if you just want to pull back a little bit. Good. And then you can push against my hands here. Good. And then for her feet, I would do the gas pedal. I would have her push on my, push here, and then you can pull back. Good. And so everything in her lower extremities is equal in strength and has full range of motion bilaterally. And then I will check her sensory, see if her senses or her sensory is intact. Okay, so you can close your eyes and then let me know if it's a sharp sensation or if it's a dull sensation. Okay?
Sure.
Okay?
Dull.
Good.
Yeah.
Okay.
Soft.
Soft, yes.
Dull.
And I'm going to do one here.
Sure.
Good. And I'll do both of her lower extremities bilaterally. See that?
Do it again.
Sorry.
Dull.
Good.
Sure.
Good. So all of her sensory is intact from her upper extremities to her torso to her lower extremities, all bilaterally. So that completes my assessment. I'm going to go back and check off one thing, and that was to smile. I'm going to note if there's any facial drooping. Okay, good. So she doesn't have any facial drooping, so I know everything's intact. She doesn't have any signs of a stroke or anything like that. And I think that completes my assessment. Thank you.